Hello and welcome to In Conversation, the Harley Street Health District podcast. I'm Professor Jenny Shand, and it's a pleasure to have you with us today. We're coming to you from the heart of one of the world's most iconic centres of healthcare excellence, the Harley Street Health District. For over 150 years, this collection of clinics, hospitals, research and specialist expertise has shaped the landscape of modern healthcare. And yet what makes this district remarkable is not just its legacy, but its relentless focus on the future, pioneering health technologies, accelerating access to care, and reimagining what patient-centred healthcare looks like for the future. In this episode, Legacy to Leadership, we're joined by three chief executives who are steering that evolution. I'm going to ask each of you to introduce yourselves. John.
I'm John Reay. I'm President and Chief Executive of HCA Healthcare UK. We've got 6 hospitals in London, and 3 of those are in West 1. Within the Harley Street Health District itself, the Harley Street Clinic and the Princess Grace both sit at each end of Harley Street. And we also have a number of outpatient clinics and primary care outlets, and as well a Phase 1 trials research unit called the Sarah Cannon Research Institute.
Thanks very much, John. I think we're going to come back to some of those themes around research as well later on. Mark.
Hello, Jenny. I'm Mark Kildea. I'm the Chief Executive of the Howard de Walden Estate, the curator and owner of the Harley Street Health District. For those who don't know what we mean by the Harley Street Health District, I'll give it some geography. It runs from Marylebone Road, just north of Oxford Street, and west it will go to Marylebone High Street and all the way across to where the BBC building is. It's been synonymous with healthcare, as you said, for about 150, 160 years. And I would say, John, it also includes the Portland Hospital. So there is one extra hospital that we consider to be in the Harley Street Health District.
Great.
Thank you,
Jenny.
Al.
My name's Al Russell. I'm the Chief Executive of the London Clinic. The London Clinic was born in 1932 and born on the Harley Street, north end of Harley Street. So we've grown up with the Harley Street district. Now we have 8 buildings on the north end of Harley Street. We employ 1,400 people. We're a charity, and our purpose is to advance healthcare for the benefit of the wider community.
Thank you, Al. In the conversation, I'd really like us to pick up some of those pieces around clinical excellence, how we are evolving the environment to really be at the front and forefront of healthcare, and also how collaboration is shaping this new era of health. But just thinking a bit more about the buildings themselves, Mark, I want to ask, how does your team balance these heritage buildings with the need for modern clinical space?
Well, they do a fantastic job, and they've been doing that for some time now, over the last 30 years. We've really upgraded and improved a lot of the buildings in the Harley Street Health District, but I'm always amazed at how we have to work assiduously with contractors, with designers, in order to be able to shoehorn into, in some instances, what is very complex medical equipment into buildings. And the more often you do that, the more experienced you get, and the more often you speak to hospitals and clinics and you ascertain what their needs are, the better we get at it. So we've got a very experienced team, and they work very hard, and I'm very proud of the work that they do.
Thanks, Mark. And John, I don't know if you want to share your experience of the team when you were building the Women's Health Clinic.
Well, a very interesting project. 2 very large Harley Street houses. They were, if you like, Victorian and Edwardian palaces. 27 to 29 Harley Street were adjoining clearly, and Mark's team actually created a medical clinic environment before we took it over. So they joined the 2 buildings together. They created space for an MR scanner, for a CT scanner. And for us, that made it very simple to move in, put the equipment in, and create this amazing women's clinic, which offers women's health, the whole range of specialties. And the place was an instant success because for women seeking treatment, everything they needed was in one place.
And that's a fantastic example of both curating these buildings to offer different service offerings within them, but also being at the front of these healthcare trends. And women's health is a huge area where people are looking for services to be delivered differently. And what you've been able to achieve through that environment is really exciting. And Al, I'm really interested. Robotics is something lots of people talk about. And innovation is two ways. So we learn from clinical trials, we learn from the NHS, but we also learn within our private settings, and that scales and expands out. Can you say a little bit about how technologies are reshaping what excellence means for you and your team at the London Clinic?
I think the independent sector plays a great role in nurturing innovation. In our case, we adopted the Da Vinci robot in 2005. And to John's point, with the concentration of different doctors across multiple teaching hospitals, they all come and experience that Da Vinci robot. And then it was urology, but now it's gynecology, it's ENT, it's colorectal, and it's used pervasively across the country. So I think the independent hospitals that have this concentration of multiple doctors from multiple teaching hospitals can really propagate the adoption of innovation. So in our case, we have the Da Vinci robot, of course, but we're supporting a new mechanism for prostate called aquablation, which we just completed 500 patients on that. Globus for the spine, and so it goes on. I think we have in our case, not as a charity that has a responsibility to innovate, we must adopt these technologies, and if they propagate more broadly, that represents success from our point of view.
And there is that combination of research and clinical excellence that really sits in the heart of Harley Street. And I think the description of there were 18 specialist hospitals, I think we've got 12 specialist hospitals, all within great reach, which is fantastic for staffing some of the services we have here. I think there's about 2,500 consultants who are also NHS consultants part of the week. And really keen to get into a little bit more about how you're able to mobilise research, because I think often we think about private providers as delivering elective care, predominantly insurance funded, but actually there is quite a lot of research activity that's happening within your organisations as well. I know, Al, you've got a clinical trials unit. There's an awful lot of phase 1 trials happening in HCA, John. I don't know if you want to share a bit more about your experience of research and how that builds a stronger excellence within your service offer.
Absolutely. Again, we have the Sarah Cannon Research Institute at number 93 Harley Street. That unit carries out more phase 1 trials than UCH does. It's a very busy unit. It's great for Great Britain PLC because, of course, we are able to process phase 1 trial applications within 8 weeks. That saves pharma an awful lot of money. And if you take the standard application to an NHS hospital at the moment, it will take more than 20 weeks. And of course, each week costs huge amounts of money to a pharmaceutical company. But I should say, where we don't win a trial, we don't lose it to an NHS unit, we lose it to a European unit. So it's so important for Britain that we keep this expertise here. And it's not a coincidence that we're very close to the Francis Crick Institute and many other life sciences assets around King's Cross and Euston. So again, the Harley Street Health District is so well placed. One aspect we could also draw out is the fact that increasingly the district acts as a medical village. And, it's to the credit of Mark and the Harley Street Health District team that increasingly these specialists in their different buildings are joined up so that when you go and see a specialist for a particular issue, you've also got access through referral to many, many other world-class subspecialists. So the Harley Street Medical Village creates a very integrated health hub with access to some of the best in the world, if not...
some of the best in the world. Perfect.
Some of the best in the world.
And Mark, share a bit more about that London story, because I know that you and your team have made some very deliberate decisions, for example, around lab capacity. So there's a lot of lab capacity in Paddington, out in Oxford. There's a lot of lab capacity in King's Cross, out in Cambridge. How did you think about your role within that London life sciences narrative?
Yeah, I think, John's alluded to this earlier. We're in a great location. We're very fortunate to be in this location. And if you think of that, the area between Paddington and King's Cross, it's an area that's dominated by healthcare, research, education, innovation, life sciences. It's a very knowledge, they talk about the knowledge quarter, but I think it's more of a knowledge corridor. And what we discovered with the Harley Street Health District was we did some research about, now looking back about 4 or 5 years ago, and we discovered that there are a lot of businesses that choose to be in this area, that cluster in this area, and they would be, I class them as healthcare support with a digital footprint, and then realised that this is health tech, and they're here for a purpose and for a reason, and it's being close to those large NHS trust hospitals either side, the independent health providers. They want to be in this area, and they've chosen to be here for a purpose. And so what we have decided to do is really try and align more with innovation. How can innovation be better connected to health providers? How can we help innovators attract and scale up capital too? So this is another addition to the Harley Street Health District's objectives.
Thank you, Mark. And that's a big part of the London Clinic story at the moment, with the North Western collaboration around research and innovation. What's that doing to bring more innovation to your services?
North Western Medicine are a very large not-for-profit hospital based in Chicago, serving the metropolitan area of 10 million people in sort of Illinois. They call it Chicagoland. And they have a responsibility to innovate. So they're very interested in accessing the intellectual capital that is available in London and very often gets exported to the US. So through the London Clinic, we're able to nurture academic links with Northwestern Medicine and create academic appointments there. But there's plenty that we're doing in London as well. So we have a clinical trials unit. It's small compared to the NHS units, but we see our role to support some of the NHS trials that they do. So whether that's biobanking, we do a lot of work in stem cells. We're doing currently supporting a trial for MS, actually, MS when it comes back, and how we can use stem cells to support that. And also a very interesting trial on lung cancer and immunotherapy. We'd like to scale that. And Northwestern Medicine are attached to a very large medical school. And so we've had several education events where we've invited doctors from around the Harley Street area alongside Northwestern Medicine academics, talking about lung cancer, talking about motility and digestive diseases. We will continue to do that.
Thank you, Anne. That's a really exciting collaboration, reaching that global audience and trying to share some of that knowledge exchange. And Mark, we're seeing a little bit on the district of some increases in research activity. So, for example, at Recognition, 50% of the patients are NHS-funded research. And that's really exciting to see those collaborations happening. What does collaboration really look like between private providers, the NHS, our academic institutions? What's that looking like in practice for you, John, and Al, in your organisations?
Well, we've got multiple examples. One, for instance, is the provision of private patient units within NHS teaching hospitals. So HCA has an agreement with University College Hospital, very close, to provide a private wing, which provides treatment for blood cancers. Very innovative. They recently did a Vertex trial, actually, which was really groundbreaking immunotherapy treatment for thalassemia and sickle cell disease. And had we not done the agreement at that time, it's possible that drug and the competence to administer it would have left this country. We were able to deliver it. Very, very expensive. You have to put down a deposit of $2 million 6 months ahead of time. And we were able to attract international patients for that treatment. I'm delighted to say that subsequently the NHS has made an agreement with that particular company to deliver 50 treatments to children in this country. So we played a role in keeping that particular drug within the country and helping to introduce it to the wider public. But there are many other examples. The private sector takes a big part in proctoring student nurses. So our own organisation proctors over 300 student nurses a year. We also have over 65 resident doctors on postgraduate qualifications, which we pay for. And we're exploring ways in which we can proctor trainee radiographers, physiotherapists, and so on. So we play our part. An interesting statistics, the 4 private patient units that we run for Guy's and St Thomas's, the Christie, UCH, and for University Hospital Birmingham, have delivered over £100 million to those trusts in our revenue share agreement. So that's money that goes directly back to the NHS and to be spent as the NHS sees fit. And I'm delighted to say that the NHS have been really receptive, increasingly receptive over the years to the contribution that the private sector can make.
And Jenny, can I just add about, I think the NHS as private patient units can be used as exemplars that are already operating in the Harley Street Health District for innovation that can be more broadly back into public healthcare. And the example I will use is Guy's and St Thomas's Specialist Care on Wimpole Street, who have introduced the Neotom Alpha CT scanner, which I'll try and explain, but no, it has a more sophisticated way of capturing data through electronic signals rather than photo. And that means that it has better imagery of the heart and muscles, organs that move. They're not static. So actually, that's the first, I think, of its type in the country. And it's, you could imagine that will be capable of being subject to funding, of course, but when it's successful in use and patients have been treated and with better outcomes, you would imagine that is then capable of being rolled into the NHS. So that's an example, I think, of where Harley Street can lead in terms of technological innovation and the best imaging diagnostics available.
And it's really interesting to think a bit more about what does collaboration here look like that you can't do elsewhere. You're from different organisations, but you're also aligned on some of these new innovations and ways of treating patients better. And it's really exciting looking at the concentration of cancer, for example. So that remains a global challenge. The UK has poorer outcomes than we should do, partly because of late stage of diagnosis, so health-seeking behaviours, but also about access to some of these novel therapies. Share a little bit more about actually how we can lean into that challenge as a collective.
Yeah, absolutely. And I think the ideology of private versus NHS is starting to dissolve now. Yeah. So our excellent trade body called IHPN did a survey last year, which said that 70% will consider independent care, and young people, 44% will consider independent healthcare. And then you overlay that with the picture in our country, with 3.5 million people living with cancer today. Macmillan say that's going to be 5.5 million by 2040. And just a few weeks ago, BBC were talking about how our nation is struggling to meet the turnaround times that make such an impact on outcomes. So we can't and won't just stand by and observe that. So John and I, we both do the most complex cancer treatment, CAR-T, the immunotherapy innovation that is currently real today. So we must take a bite out of the challenge that the nation has. And I think the independent sector sits alongside the NHS in dealing with the challenge we have as a nation.
And I think challenging some of those historic assumptions is really important. So people often think that the private sector is just straightforward, elective, outpatient activity or day case surgery. And actually, even across the district, we've got a lot of ICU beds, so intensive care units. Yeah. And actually that speaks to the specialist care that's being delivered here as well, doesn't it?
It does, yeah. So rough numbers, there are 40 ICU beds. And that's getting close to one of the big neighbouring NHS hospitals. So there's serious capability. And actually in the nation, independent healthcare, a lot of the acute work is concentrated into London. And within that's in the Harley Street area.
John, do you want to come in on that?
Well, a couple of points I wanted to raise. One was, first of all, the range of specialties available in the Harley Street district. We have private primary care. There are many practitioners here. We also have, as Mark mentioned earlier, the Portland. We have IVF units. So from treating children through to adult care, we have the whole range of medical and surgical specialties, through to stroke care at the nearby Wellington Hospital. So, and one of the interesting things which perhaps has been a trend which has changed quite dramatically in recent years is the increase in medical treatment. So we have fantastic surgeons. We've always offered the most advanced complex surgery. But increasingly with, as mentioned earlier, cancer, with obesity, with cardiac issues, the range and depth and quality of the subspecialists who treat medical conditions is beyond anywhere else I know in the world. It's all here. The expertise is all in one place, and people cross-refer and make sure that every aspect of somebody who's got comorbidity is treated.
And on that piece, John, so Mark, your team are committed to whole health as a concept underneath your clinical excellence. Do you want to say about how that's evolved and how that's shaped who you're thinking about attracting to the district and how you curate that community that John's referred to?
Yeah, I think one of the hallmarks of the district that we never really made much of was the fact that you have this independent health district, but it offers this whole range of activity from having an appointment with a GP to imaging, diagnostics, day case surgery, overnight surgery, rehabilitation. You can get all of that in the Harley Street Health District. But I think what distinguishes it for me between any other district that I'm aware of, it isn't sponsored by some major health care system. It is truly independent. I mean, they both these chaps either side of me represent two of the largest hospital groups in the district, but the vast majority of it is really a bunch of SMEs all knitted together who survive by collaborating with each other. And I think that's the distinguishing feature of the Harley Street Health District.
And that's uniquely different because if you look internationally at many of these health campuses, as Al alluded to, you have huge provision, you have huge academic presence and innovation, but usually that's under one umbrella, one organisation that sponsors that. And as you've described, the district is a collection of lots of different organisations, but aligned by the same mission. And how do you think we can really build on that unique platform?
Well, I think, again, we rebranded the district, which a couple of 18 months ago, which didn't really sound a lot because we moved it from medical to healthcare, and we, instead of it being area, we called it district. But really, the basis upon that was from research that told us that by the occupiers and people who wanted to be in the Harley Street Health District, they were saying, you've got this voice, you've got the authority to do more. We were already encouraging collaboration, but we weren't doing it as deeply as we possibly could have. And I think that gave us the vote of confidence to try and bring health technology. We want this to be the place for health tech to take place. We want to make better connections between innovation and health providers. But I think up till then, we did not feel that we were capable of doing it. But because ultimately, as they've reminded me beforehand, we're a landlord, we're a property landlord, but we're more than that.
And Harley Street is a global brand. So it's not just a street that's recognised across the UK. It's really got global presence. And I guess for both Al and John, that's really important for your organisations. How are you seeing the flow of patients changing globally in recent years?
It's hugely important. And I'm delighted to say that between us, we draw hundreds of millions of pounds worth of medical tourism to London. And just a quick point to make on that, for every pound that a medical tourist spends in London, their relatives will spend an equal pound on hotels, retail and transport. So we're good again for London PLC. But attracting these international medical tourists, again, is a key part of Britain's export market. There's so much opportunity there. You asked how it's changed in recent years. I would say that people globally are more willing to travel further for excellence in healthcare.
John and I sit on a collective called Healthcare London, and our vision there is that the medical tourism market is about $15 billion. We're not getting our fair share in the UK, despite the fact, as John said, we've got such a concentration of world-class doctor expertise. Why is that? We could spend time on, but it represents an opportunity to build further referrals across the world. There's no better place for a patient and a family to be than in the Harley Street healthcare district. So it's a real opportunity for us. And I think as a nation, we need to market London as consistently as some of our competitor countries are marketing their brilliant healthcare provision. But I think we can match them and more. 30% of the medical tourism goes to the US. That's very expensive. It's very good, but it's very expensive. So I think that our district has a real role to play in that, and a fabulous sales pitch, frankly.
Let's get into a little bit more about that talent and leadership opportunity. So it's quite unique in the UK that you have got NHS consultants who work part of the week in an NHS organisation and part of the week in a private provider. What does that mean for you as organisations? How do you help support and shape those individuals, but also what are the benefits that brings back to the NHS?
We have that unique opportunity to bring the best of the NHS into the private sector. So these specialists will work together on multidisciplinary teams when they're treating either cardiac or cancer or any complex condition. So if I'm a patient coming in, say, from the City of London for treatment, in every case, if I'm coming in for cancer treatment, my condition would have been personally reviewed by a team of pathologists, radiologists, surgeons, physicians who've agreed on the best course of treatment for me. So we're offering personalised medicine. And again, this is very closely governed. We deliver a guarantee to the insurance companies, to the patients, that every single cancer patient that needs complex treatment is looked after in a multidisciplinary team setting.
And Al, as a charity, how do you talk about your social impact and the sort of patient impact that you achieve?
Yeah, so there are sort of three dimensions: education, innovation, and research. So education is very similar to what John mentioned, actually. So at the moment, we've got 20 nursing placements in our hospital from various universities around the area. We do a dozen PhDs, some actually purely scientific, in novel cancer therapies at Imperial and UCLH. And we're starting to use our training capability to train people outside our walls, outside the London Clinic, to support advanced life support, for instance. So that's education. Innovation we touched on. Yeah, so making sure that when we're making business case decisions, we're making them based on, is this furthering innovation, and should we back this? Yeah, and sometimes you have to take a leap of faith on the numbers just to support that innovation. And research is the sort of clinical trials dimension, which I think will ramp a lot with our collaboration with Northwestern Medicine in time. From our point of view, to fulfill our purpose, the more patients we're seeing and the more we're contributing to the wider healthcare picture, the better. But also we want to generate surplus so that we can put that back into those three dimensions.
Mark, do you want to say a bit about the conversations you have with the estate about that social impact? You've invested huge amounts into attracting Healthtech companies to Hale House, the home of Healthtech in London. Say a little bit more about what's motivating you behind that.
Yeah, look, I think when we look at healthcare generally, there's a shortage of workers, doctors, good physicians in all areas. And I think that, technology has the potential to change that for the better. And what we want to do is to make sure that, I think it'd be very easy and very lazy to suggest that Harley Street's this kind of heritage area, but what we want to do is to be at the vanguard of innovation, to help it, to make it accelerate where it's needed. And in doing that, we're in this building, Hale House, and UCL Partners, they were our first tenant here. And for those who don't know, UCL Partners are a health innovation network, one of the largest, and they're looking to bring innovation in its scale and effective cost into the NHS. So what the Harley Street Health District is aiming to be now is to be a force for good in bringing innovation into not just any health setting, whether it's independent health, public health, but it's inevitable by accelerating that innovation that there's a potential for it to be brought back into public care at effective cost and scale.
So Al, what surprises you about the Harley Street Health District?
From a patient point of view, they often hear the London Clinic and think we're a sort of a dentist chair on the corner somewhere. And they're absolutely amazed. It's like sort of Doctor Who walking to the TARDIS, like just the enormous depth of capability that we have behind these sort of beautiful buildings. So that I hear that a lot, actually, for those that aren't familiar with the London Clinic. So thankfully, many are. I think that, just want to pick up on Mark's point about Hale House. I think incubating new ideas is a very exciting thing. I think having that within the district, and I'm looking forward to working with UCL Partners, for instance, who are in the building we're talking here today, how can the London Clinic incubate that, make it useful, and share it with our Chicago friends and indeed NHS partners. So I'm hoping to find some pleasant surprises that can really help our productivity and indeed broader healthcare institutions thereafter.
Thanks, Alan. That's a really exciting example around your innovation plans of really connecting different parts of the district who are already working on similar things, but actually coming together and getting that mutual value. So it's fantastic for UCL partners to help organisations to test and scale through the London Clinic, and it's great for your patients and your staff, hopefully too. John, what things do you think would surprise people?
I think what constantly surprises me is the amount of supporting medical care that's here. We haven't talked today, but there are a very wide range of expert mental health practitioners in the area. We've got some tremendous doctors who are interested in proven health span, longevity. We've got some of the most amazing therapists in the area, osteopaths, physiotherapists, wonderful hearing services. So alongside the doctors that we talked about earlier is a wonderful world of supporting practitioners who take the care of the patient forward beyond the interventional stage. So we really have truly a medical community here.
Thanks, John. And there's an awful lot changing about longevity, how we're learning to live with different conditions. Al, you mentioned about the concentration of oncology services. Living with cancer is going to be a huge cohort going forwards, and many of them may benefit from some of the wider services and support that exists across the estate. Mark, what surprises you about the Harley Street Health District?
Well, I'm going to go back to when I started with the Howard de Walden Estate, and there was a building that we had spent £5 million on. It's now occupied by the guys in St Thomas's, who were then Royal Brompton, and they spent £12 million fitting it out, putting great sophisticated equipment in, and they spent a lot more than that since. So I think it's this idea that, that the buildings are valuable in themselves, but it's what goes inside them, the quality of the staff that work in this area, the world-class consultants and surgeons. So, you put that sort of human capital together alongside the capital investment that the hospitals make. It's extraordinary, and it makes us small. The actual buildings themselves are dwarfed by what goes in them and what goes on in them, and then the impact that can make more broadly to society and the patients.
And this sort of United London narrative, I think, is a really powerful piece internationally, and how we hold on to that and broaden that it's not just about a collection of private hospitals. It's actually also research excellence. It's also health tech and innovation. And actually, how do we position that on the global stage is really interesting. And I think something it feels like the future might hold. Looking ahead, what are the other things that you think we can be looking ahead to over the next decade within our district? Recognising the pace of change in how we manage and support healthcare services at the moment.
We mentioned immunotherapy treatment earlier. In fact, in the private sector, the delivery of immunotherapy treatments, novel treatments, is almost unique to the Harley Street District. So innovations in treatment, cardiac and cancer primarily, but in many, many other areas. I think also continuing investment. We continue to see innovation in the area. We continue to see competitors coming into the area because they want to be part of this. So I think that the Harley Street Health District has got a very, very bright future in terms of development, investment, innovation. And I think that makes it really a jewel in London's crown and in the nation's crown. So I believe that we must continue to ensure that the governance constantly improves, gets tighter. I think we must continue to take an interest in each other, making sure that we really create a connected environment, and that we work together, as Al mentioned earlier, to attract people from overseas. I think that a team effort in this district is absolutely essential, and I think it offers a very bright future for medicine in London.
Thank you, John. And there's attracting investment from overseas in terms of health tech and innovation. There's attracting investment in terms of research excellence, but also attracting that global patient flow. And I guess maintaining our sort of talent excellence and potentially poaching some of that from internationally as well. Al, what are your thoughts about the next sort of decade for the London Clinic and within the district?
I think that we've got to step up to the challenge of increasing cancer prevalence. So that's particularly for the London Clinic. That's a kind of a leaning, and that will our model will evolve with how cancer care will evolve. and some of the complex work will happen in Harley Street, but sometimes people don't always have to come into Harley Street and to make that trip, and that's fine. I feel very passionately about London being a fabulous city. Yeah, we're proud of London. We're in a fabulous part of London together, and I want to just reinforce John's point that London PLC, UK PLC are entirely entwined, and we should be shouting from the rooftops about what a fabulous medical care we deliver. Yeah, so I'd be very disappointed in 10 years' time we're not drawing a lot of medical tourism into our area, because we deserve it, because we have very high standards and very good doctors.
Mark, do you want to come in on that? That London narrative you're very passionate about as well.
I'm very passionate about it, but I think there's a renaissance in the Harley Street Health District. And I take comfort from these two chaps sat either side of me. You know, HCA have invested in the 13 million in their women's health clinic in Harley Street. They're investing 26 million pounds in the Harley Street clinic. You know, the linear MRI that we talked about earlier on. Northwestern's commitment to the London clinic and to the Harley Street Health District. You've now got Bupa acquiring King Edward VII. That's another vote of confidence in the Harley Street Health District. So I think we can be this shining beacon for global healthcare. And I think the point that we need to understand is it's right in the heart of the city. It's not in some biomedical campus. You know, even when you go to some of these US towns and you see their great health facilities, they're not in the middle of a great city like London. So I think that puts it as a supreme advantage in terms of attracting the international patient flow. The one thing we haven't mentioned is the growth in preventative healthcare. You know, the people are worried about being ill, and I think Harley Street again can be a beacon for that, and in the sense that where it's accredited by clinical evidence, the best of preventative treatment. I think Harley Street needs to lean into that in some way, shape, or form, and I think we will see the growth in that area of healthcare over the next 10 years, and that gives me confidence too.
So, John, you've mentioned bringing and attracting other providers to Harley Street Health District because it's such a compelling proposition. You're both competitors, Al and John, in some instances, but we've also heard an awful lot about collaboration. Perhaps you could share a little bit more about how you do collaborate together, particularly recognising that sometimes new providers coming in is excellent for that collective capacity, but not always excellent for those patient flows.
Well,
John.
Al and I were certainly collaborators in forming the Healthcare London organisation. We work together when it comes to governance, so we'll keep each other informed if we think there are any issues. We actually have an obligation to do that, and we make sure that we do. I think that all of us benefit from creating a really special area. It's well known in business school that restaurant theory, the more good restaurants you put together in one place, the more people you attract. So we all benefit really from being in a district that attracts a global audience, and it's in everybody's interest to work as a team in that instance. Of course, we're competitors, but in terms of attracting the interest of the patients and encouraging them to travel, we are absolutely united in making sure that we work together in that area.
And that's a very fitting reference, John, because Marylebone Village is just next door to the Harley Street Health District. And as you said, with medical tourism, £1 spent in healthcare, your family spending £1 in retail, in restaurants around the corner. And that sort of vibe that is created, both for the staff that come and work and are able to go and access some of those retail and facilities, but also the benefit that has for the patient experience of before and after you walk into your healthcare appointment, what are you doing and where are you, is perhaps another thing that's quite distinct about the offering of the Harley Street Health District. It's not an anonymous campus built in X location, but it's really at the heart of the city. Did you want to come in, Al, about the collaboration?
Collaboration. So, exactly as John said, that we've been side by side through COVID. Which was quite a quick learning experience, side by side on building Healthcare London, which is important for this area. But it's the things you don't see, actually, which I think are really interesting. So if on a Tuesday you're missing a piece of theatre kit for whatever reason, we call the local hospital, there's never any hesitation both ways, because what matters is having the right thing for the patient at the right moment. That happens all the time, doesn't it, John? Yeah.
It's an unwritten rule.
And Mark, you deliberately bring people together in your healthcare forum to really recognise that you're a community of providers all aligned around this common mission. Do you want to say more about how that community's evolved over time?
Look, we're always looking for the opportunity to make sure that there's greater collaboration in the Harley Street Health District. You can actually feel the energy when you have an event here at Hill House, or when we went to Health Amsterdam, Health in Europe and Amsterdam earlier in the year. It's a great opportunity to try and bring people together. And I guess that it's not something that you would typically think a owner-occupier would necessarily do. But we feel so passionate. We do think that the magic ingredients of our ownership are the Harley Street Health District and Marylebone Village. And therefore, those are the forums that we try and curate and bring people together. And we learn a lot from it as well.
Yeah, and it's a very curated community, and we talked a lot about engineered serendipity. How do we build deliberate connections between this evolving health tech innovation and our providers? And as Al's alluded to, we're doing some very specific things on that to get that sort of innovation exchange happening. And how are we building spaces like Hale House of bringing those communities, giving them a home of health tech, somewhere they can feel identity, but also have access, this phenomenal opportunity, I guess, to test and scale solutions that will be collectively beneficial to our society. Well, thank you to John, Mark and Al for sharing your insights, sharing your vision and sharing the reality of what it's like working in the Harley Street Health District. It's clear that it's in very safe hands, but it's a future of possibility, and certainly I'm very optimistic about what that might hold. So thanks for joining us and sharing your ideas. And thank you all for listening. And this is the first of the In Conversation Harley Street Health District podcast, and we'll have a series of conversations coming up that we hope you will enjoy engaging with. Thank you.